Dr. Suzan, she's going to speak about advantages of the fish in diagnosis of cytogenetic abnormalities. She is from Alexandria University, Alexandria, Egypt.
Bismillah ar-Rahman ar-Rahim. I'm going to talk about the advantage of fish. We actually started the Center of Human Genetics in Alexandria University. We were doing diagnosis, prevention, treatment, and counseling. But we found that when we had persons affected with disease, genetic disease, we could not, if we diagnose even, we could not help them in any way. So we decided that we should help them, and those who are affected, to try to rehabilitate them. This was not possible in the university to do rehabilitation, speech therapy, early intervention. So we founded the Genetic Counseling Society in 1974. And we do a different counseling, rehabilitation, diagnosis, and prevention. We like to do prevention very much if we can. It is important. Sorry, I am a bit allergic today. This study reports the results of the of patients coming referred to the Genetic Counseling Society for genetic counseling. The objective is to, of this talk is to report the result of fish applied for rapid detection of chromosome abnormalities in prenatal diagnosis, as well as providing accurate diagnosis in patients presenting with disorders of sex development. This is very important. This is very important because we have a lot of disorders of sex development, and sometimes they come quite old, being a female, and they were supposed to be a male, you know, or vice versa. So it's very important to diagnose them quite early. All patients were referred to the Genetic Counseling Society for genetic counseling, and we are actually the first until now, but we hope other centers will be that do the fish analysis in Alexandria. The subjects were 612 patients referred for cytogenetic evaluation. We chose 30 cases for prenatal diagnosis and 129 cases who suffered sex development. The prenatal diagnosis, we used the probes, the classic alpha satellite probe for the X and Y, and the probe for chromosome 21 on cultured, on non-cultured amniocytes. Cases were referred due to abnormal the prenatal diagnosis cases were referred due to abnormal quadruple screening test for Down syndrome and or abnormal ultrasonography history of previous Down syndrome child or advanced maternal age. The results of fish were comparable to those obtained from amniotic fluid cultures of the patients. The results of fish, there were 18 showed two green signals of the X chromosome, and 11 showed one green signal of the X chromosome and one red signal of the Y, and only one case showed trisomy 21. This is uncultured amniocytes showing the green signal and the red signal, and this showing two green signals of the X chromosome. The uncultured amniocytes showing 3 red signals of the chromosome 21. The results of fish were ready within 48 hours whereas the results of amniotic fluid cultures were ready within 2 to 3 weeks. Actually, it takes in our lab about 3 weeks. The rapidity with which the pregnant woman was giving the result of fish alleviated much of the tension and stress which resulted from the long duration she had to wait before obtaining the results of the amniotic fluid culture. In the sex development abnormalities, we had 40 cases, 45X Turner, and 35 cases mosaic with the X, and 12 cases mosaic with the Y, and 37 marker cases, 45 chromosome, 45X plus marker. The fish analysis using classic alpha satellites for X and Y, and was performed in cases of non-mosaic 45X chromosome to detect low-level sex chromosome mosaicism, and also in cases with chromosome markers to identify the origin of this marker. The protocol followed was that provided by the manufacturer. The result, disorders of sex development results, the fish showed that the 45X chromosome, the 40 cases, 22 had pure 45X, 12 cases were mosaic for X chromosome, and 6 cases were mosaic for the Y chromosome. The 37 markers, there were 13 cases showing X, origin of the X, and 24 cases, which actually is quite a lot compared to many other published cases, with isodicentric Y chromosome. This showing interface of green signal of X. This interface showing one green signal of X chromosome and 2 red signals of the Y chromosome. This show the interface with 2 green signal of X chromosome in A. B interface with 1 green signal of X chromosome and 1 red signal of Y. And B show metaphase with 1 green signal of X chromosome, 1 red signal of Y chromosome. This is a metaphase. Fish is recommended in all cases of Turner syndrome with apparently non-mosaic monosomy X. Genital ambiguity possessing a marker chromosome to identify the nature of the marker. The presence of the Y chromosome is important due to the increased risk of gonadoblastoma. We can conclude that fish is a useful tool in detecting low-frequency cell line and identification of the nature of unknown chromosome markers. It is therefore an adjunct to karyotype analysis and provides a sensitive, specific, rapid, and informative technique to identify sex chromosome mosaicism in Turner syndrome and finer characterization of chromosome markers in sex chromosome anomalies. And also fish provide rapid result in prenatal diagnosis as it is used on uncultured amniotic cell. It takes 48 hours instead of the long wait of 3 weeks needed in amniotic fluid culture. We recommend that fish technique be applied in all specialized centers to aid in rapid and accurate diagnosis. It is illegal to do abortion in Egypt, but it is possible if it's very harmful to the mother or to the child, and it has a lot of permissions to be taken, but it has to be done quite early, before يعني قبل الروح before it's alive, it's an alive fetus. We do it only in certain cases, but actually most of people, they don't, we let them choose if they want to terminate or not. And a lot ask to do it, and they say we will terminate, and then when the results are bad, they refuse to terminate. They feel it's, from the religious point of view, they feel unsecure if they do it. But it differs from different. We do counseling before, and it's the parents who choose what to do. We tell them all the possibilities of this abnormality, and they are free to decide what they want to do.
Okay, thank you.